Now, health, they say, is wealth. But how much of this wealth can Nigerians boast of today? The nation's journey in the health sector has been marked by inadequate funding and policy inconsistency. For years now, the country's health sector has consistently faced a brain drain as a huge number of highly trained professionals have left for the UK, the US, Canada, just to mention a few, as a result of poor working conditions, low pay, and lack of career advancement. Now, this leaves the healthcare system with critical shortages, straining existing staff, and leading to understaffed hospitals, limited access to specialized care, and worsened health outcomes, particularly for maternal and child health. To unpack this development is a Nigerian medical doctor based in Texas, US. Dr. Charles Oludare joins us right now. Dr. Charles, thank you for joining us. I really want to know exactly what you would say is the major challenge affecting the Nigerian health sector at the moment.
Thanks, Chair, for having me. Thanks, everybody. When we want to talk about if we are going to truly analyze the health sector like we do in the health sector, first off, before I even say anything, guilty as charged, I'm one of those medical doctors that jackpot that you spoke about in your opening. But before we can analyze this problem like we do in the health sector, we have to have an assessment, an accurate assessment. And to have an accurate assessment, sometimes you have to get to the onset of a disease, right? So if we want to go to the onset of the current health sector problems that we face right now, we have to go back to our political debacle in the 60s that happened after the military interregnum, and then a lot of our hospitals were all federalized, because that created an inefficient structural problem for the country. We have a situation whereby if a doctor should drop dead in a hospital, which happens, before you can replace that doctor, you will need to do a needs assessment, send it to the permanent secretary of the Federal Ministry of Health, who will send it to the secretary to the state governor, to the state government, who will send it to the president. Before you can replace a doctor, or before you can make business decisions, maybe expanding your operating room, you need funds and all those things. So when the federal government, while a lot of people might say the government's funding and all, sometimes I feel like the government's intervention is even worse than what it is failing to do in terms of funding, because this problem is very, very pivotal and very structural. This is global. This is not something that you can pinpoint to maybe the maternal mortality, but this has created a structure whereby the federal government is consistently funding an inefficiency. The most inefficient hospitals in Nigeria are the government-owned hospitals. You have all been to it. If you've not been to it, you have relatives that go there. You see the way the doctors treat you. You see the way the nurses treat you. You see the way everybody in the health sector treats you. In such a way whereby even the primary employees of the government, who are the consultants, a lot of them, you seldom find them at their place of work. It is like you being paid by News Central to come to work, but then you don't have to be seated on that seat to interview me. As a matter of fact, you can even pop up in Arise News or TVC or channels conducting an interview. Because why? The federal government has guaranteed their income, they have guaranteed their subvention, but they don't demand an outcome. They don't demand, an outcome, be it maternal mortality, whatever. They don't demand anything. So when there is this competition, and we have people in the private sector who don't get any support from the federal government, as if the federal government is only responsible for the health of people who are in close proximity of the federal institution. All governments, not just federal government right now, federal, state, and even the local governments, they are responsible for health care of everywhere. So when the federal government and the government in general started getting into the business of owning hospitals as opposed to funding all hospitals, they have already created a system that creates a form of, we can call monopoly, that does not even work. That is why when you go to all these hospitals, you are going to have a bad experience. If you want to have a procedure done in our federal hospitals right now, it might take you maybe a prostate removal, 9 months, 1 year, 2 years. But you can have that same procedure done by that same doctor across the street tomorrow. And you can think about the fact that these are inefficiencies whereby private sector, people that go to the private sector can be going to these same hospitals and be able to, fund their health care and all these things. And these hospitals will be able to run efficiently, bring me more money that will, help the system. But this is not being done because of that structural problem that the federal government created years ago, and they keep on worsening. So that already created a system.
Sorry, Dr. Oludare, I have to just interject right there because of, we're kind of pressed for time. But then I'd love to know, because the brain drain situation in Nigeria is alarming, right? So tell me, from your professional view, what are the most urgent reforms needed to stop or at least slow down the brain drain rate in Nigerian health sector right now?
Yeah, before we talk about the brain drain, we have to talk about something that happened when I was in university, whereby from 2008 to 2009 sets, they started indexing the number of medical students that the Nigerian teaching hospitals could take in. So yes, we know that we don't have good facilities, but from our roses were growing out of the concrete pavement and we're surviving, right? So by doing that, you have already reduce the number of people that you are training. So right now we have a situation whereby the residency, they are nobody to fill it. People run away because of the welfare and the economic hardship and the way doctors treat each other. I mean, when I was in the system, I was given a query for sleeping in my call room, despite the fact that I've been working 96 hours before then, and I only took a 30-minute nap, which is not a crime. That is why there's a bed in the call room. I had a friend who was not allowed, who was failed because he failed to go and pick up his boss's child in secondary school. So these are things that occur, and the federal government funds it. So why will you want to be in that same kind of system? Why will you not want to go? I will never tell any medical doctor that wants to leave Nigeria, despite my love for Nigeria, not to leave, because it is just inhumane. You don't have, you look at your bosses and you see your future. And that future does not look nice. And then you see the way the system treats you, the way you are unappreciated, the way you are undercompensated. And these things frustrate you. You get overworked. I worked for 1 whole month when I was in 24 hours every day. So how do you expect me to have a work-life balance? All these things are part of the problems that definitely contribute to the brain drain. So for the government to reverse it, first off, we need to go and fix the structures. We need to ensure labor laws. We need to train more people. Thank God this administration has started revisiting that. Revisited that, but they have not even done it enough. Your channel spoke about some people in Calabar who the FDCN did not want to grant a license, despite the fact that we know we don't have doctors. We have some people who have been trained, and you are saying you don't want to give them license. You can imagine the kind of thinking or mentality of our decision makers. It is just dismal to me to hear that. So all these things need to go. The federal government is doing more harm in its policies that is facilitating this brain drain and this mass migration of doctors, and it is going to continue. Definitely we need to fix economy, because you said it in the beginning that health is wealth, but what you didn't say is that wealth brings health, because you can spend money to do treat yourself. Yoruba people will say, what you see, that's money where you get, if you treat your diarrhea. So you have to also make money. The economy has to get better. We need to, thank God we stopped all this, money laundry of subsidy and dollar multiple exchange rates. We need to put that money, redirect it back into the critical sector. But if you want to put money in that critical sector, if the sector is weak, you are not going to be able to grow it. So if we don't do the structural things and allow the investments to come in, and then, think about where I said 2008, right? That is 18 years of under-training medical doctors. It will take us another 18 years to get out of it, because why? Doctors are not going to be coming from the United States or a lot of places to come and work in Nigeria. So we have to train our own people. I understand that some people will still have to migrate, because Japa brain drain is not new to my generation. It has been happening. Dr. Malu, Dr. Olukoye, who have been celebrated in the United States, were trained. Even our Alipate, who is our minister right now, was trained in Nigeria and became a success abroad, right? And it was not in this generation. So that is something that is constant. But if we are training enough, I mean, the embargo on new universities is just something that is always worrisome to me, because when you start banning things, that means you are not using a lot of sense in the administration of it. So all these things need to be fixed. We need to definitely train more, so that while people are leaving, you are still going to have enough residual to keep your system going. India also has brain drain. China also has brain drain. But guess what? They don't have the same critical shortage of health workers as we do. And definitely the treatment of doctors needs to be better. The accountability for the consultants. A consultant once said to a doctor that he is useless and his wife should not be, making love to him, and his children should stop calling him father. In my president, when I was in medical school, all this physician bullying does not make people want to stay in the system.
Dr. Oludare, before we wrap things up, I've heard you talk about training. But at the same time, we understand that, of course, perhaps it might be a case of the number of medical students we have right now. I mean, when you compare it to the number of teaching hospitals we have, perhaps there might be an issue of inadequacy. Do you think right now what the government should be looking at is building more teaching hospitals? Would that help in any way?
The government... It will help. We need to always find ways to expand capacity, but the governments all over the world, not just in Nigeria, even in the best countries of the world, America, UK, Europe, they have shown that they are not the most efficient at managing stuff. So Nigerian government can be funding hospital construction and hospital expansion, but they don't know how to manage it. That is why we have people finish residency and they don't have jobs. Imagine someone who is a consultant, neurologist or whatever, he does not have a job, he has to leave Nigeria. A lot of my colleagues that went through the system, that finished residency, they've all left, because the Nigerian government has created a system whereby they cannot graduate and compete with the school where they are treated. They cannot go and set up hospitals in a rural area that is underserved and get federal government funding for the health care that they will be delivering in that place. So we definitely need to train, we definitely need to expand, but the government needs to hands off control of hospitals.
All right, thank you so much, Dr. Oludare, for having this conversation with us.